right, so what brings you in for your foot today?
I have some pain, like on the top of my foot here.
When did that start, or what happened?
Well, I've been training for a marathon, and I kind of noticed after one of my runs that the top of my foot was sore after one of my runs. And then as I kept running, it started getting more sore as I was running. And now it sometimes hurts even when I'm not running.
Okay. Do you remember any incident that started it, or just kind of?
Not anything in particular.
Okay, so you didn't like fall or do anything like that?
No.
Okay, and can you point to where it hurts again?
Around here.
Okay. Anything like this ever happened before?
Nope.
Any other relevant history? Have you broken your ankle or anything else on kind of this lower leg?
No, I've never broken my ankle.
Okay, and can you describe the pain for me?
It started out kind of just like dull and achy, kind of on the top of the foot. And then as it's gotten worse, it's become a little more pointed and specific to this area here.
Okay. Anything that makes it worse?
Running.
Excellent. And anything that makes it better?
Not running. And some ibuprofen and ice a little bit.
Okay. Is that all you've done for treatment?
Yeah.
And tell me a little bit about, have you changed training recently? Changed shoes? Changed running surfaces?
I've been running on the road. And this is my first time training for a marathon, so it's a lot more mileage than I've done before. But I have gradually built up the mileage. But it was during one of my top mileage weeks that it started hurting.
Okay, have you been doing like a training plan, a certain number of runs a week, and you've been consistent with that?
Mm-hmm.
How about your shoes? Are they in good shape?
Probably could be in better.
Okay, well, we'll take a look at that too. All right, if you want to scoot just a little bit back, so your foot's over the edge here. Start with is inspection. And the only thing I notice is that her second toe is slightly longer than her first. You said it hurt mostly right up on the top here? Okay, well, I'm going to start by palpating a little bit farther away. Let me know if any of this is tender. The tenderness over the first, fourth, or fifth. Now getting closer to where you said it hurt, back here on the, up here. And then how about down here?
Starting to get a little tender there.
Okay, so more sore there, and then how about here?
More tender.
Ow. Okay, right there is the worst. But, okay, so nothing down in your toes.
No.
So you would say the worst spot was right here?
Yeah.
Okay. All right. Let's just take a look really quickly at your range of motion. I want you to bring both of your feet up as far as you can, and down, and out, and in. And bring them both back again for me one more time. Okay. So active range of motion within normal limits in all directions. Let's just really quickly, like here at passive, so that's all right. And sorry, I'm trying not to put my finger right on the sore spot. That's okay. Yes. And we'll just look at it on both sides just so I can compare. All right, and I'm gonna push down against my hands. Actually, come a little bit farther forward so your knees are off the edge of the table. Okay. Okay. So same thing, push down against my hand as hard as you can. Point your toe, point your toe, point your toe. Any pain with that? Okay. And then I'm going to try not to touch the sore spot, but the same thing, you're going to pull up as hard as you can, hard as you can, hard as you can, hard as you can. Okay. Any pain with that? Pull up again. And down. Okay, strength is 5 out of 5. And then pull you in, and now push out against me, pull in against me, and the same thing, pull in against me, pull out against me. All right, again, strength is 5 out of 5, inversion and eversion. And you can scoot back again. And just look at the range of motion movement of your toes as well. Can you curl your toes down for me? Curl as much as you can and extend them back for me. Okay, and relax. Okay, so we're going to do a couple different tests here. That bother you at all?
It's a little sore.
Okay. Here, so I'm not touching the most sore part, right?
No.
Okay.
Ow!
Okay, that bothers you? Where does it bother you?
Like in the middle, in between your fingers.
Okay. And then same thing right here. That bother you?
No.
Not really? Okay, next one, we're just gonna look at a couple other things. Okay?
Yeah.
Okay?
Yeah.
Again, I'm gonna try and avoid the most sore spot here. Okay?
Yeah, it's a little sore
Just
under
sore.
the fingers, but
Anything there? Okay. And then there. Let's just compare on that one, just see what your normal is. And I'm just going to squeeze a little bit here and pinch here. Is that all right?
yeah.
Okay, any numbness or tingling coming down into your toes at all?
No.
Have you had any numbness or tingling with this?
No.
Any like pins and needles in your toes or anything?
No.
Okay. So that's negative over the second and third and fourth metatarsals. Well, that's the end of the evaluation. Let's talk about what I think you have.